Hello friends, welcome back to Dr. Jagdish Academy. In the previous video, I discussed the pathophysiology of hepatitis A and hepatitis E. In today's video, I will discuss two again viral hepatitis, that is hepatitis B and hepatitis D. So let's start. So as I told, in this video, I will discuss the pathophysiology of hepatitis B and hepatitis D. So coming down to hepatitis B. Hepatitis B is one of the leading cause of chronic liver problems. So now remember, in hepatitis A, we discussed that it is an acute liver disease. But in hepatitis B, we will be concentrating mainly on the chronic liver problems. So there are chronic things, chronic hepatitis, cirrhosis, and hepatocellular carcinoma. These are the features of hepatitis B. So now first of all, coming down to the structural features of hepatitis B virus. It is very small in nature. It is enveloped, different from hepatitis A, which was non-enveloped. It is enveloped. Outer envelope is present. And genetic matter is DNA, which is double-stranded, which is again different from the hepatitis A. Route of transmission is also different. In this condition, it is transmitted through sexual contact from mother to fetus. It is called as perinatal, and use of contaminated blood or its products. Coming down to the pathogenesis, how the disease actually happens. So now, hepatitis B virus, it can be transmitted through the different routes. Then by different routes, the virus can enter inside the hepatocytes. It will lead to activation of the immune response. It will lead to destruction of hepatocytes, which is manifested in the form of acute hepatitis or chronic hepatitis. And this chronic hepatitis may progress to cause the liver failure. So now, in wording, I am discussing the pathogenesis. Virus itself does not produce the damage. Remember, virus is not itself is not producing damage. So, but virus induced activation of the immune response is basically causing the toxicity, damage. So, activated immune system attacks the hepatocytes, and damage of the hepatocytes is responsible for the clinical symptoms. So, what are the symptoms? The incubation period is relatively long. It is 1 to 6 months, which is different from hepatitis A, very long incubation period. Now it can produce both acute as well as chronic liver disease. Acute hepatitis and chronic hepatitis both can take place. So now first of all, coming down to the acute hepatitis. Obviously, whenever acute hepatitis will take place, the symptoms are very similar. So as we discuss the symptoms of hepatitis A, the symptoms will be very similar. Hepatitis A, but if they are children and if they are infants, the acute symptoms are sometimes absent. You can say these small children will be asymptomatic. So what are the symptoms? Fever, anorexia, nausea, vomiting, abdominal pain, jaundice, dark urine, and light color. If you remember, just go through the hepatitis A. So these are the similar symptoms. So how to diagnose the acute hepatitis? Laboratory finding will reveal the increased levels of serum albumin, rise in the levels of hepatic transaminases like alanine transaminase and aspartate transaminase. So increase in the levels of ALT, increase in the level of AST and serum albumin, they indicate acute hepatitis is there. So now coming down to the more important thing about the chronic hepatitis of this hepatitis B, that is the chronic form. So when we say it is a chronic, so we say chronic if at least for 6 months you check the presence of surface antigen of HBV, which is called as HBsAg. This is HB mean hepatitis B, S for surface, AG mean antigen. So that means if in a patient you identify the presence of this surface antigen of hepatitis B for more than 6 months, you say it is chronic hepatitis. Or if you see the levels of these transaminases, AST, ALT for more than 6 months, you say it is chronic in nature. So this is how you define it is chronic in nature. So now the risk of development of chronic hepatitis is dependent upon the age. If these are infants, 90% of cases, but in case of adult, only 10% of cases that acute will convert into the chronic one. But very important cases in the infant. Now what are the symptoms of chronic hepatitis? Symptoms are generally the same thing. Only thing is that those symptoms persist for a long period of time. That is fever, malaise, anorexia, abdominal pain, jaundice, all kind of things are there. But they are persisting for a long period of time. And ultimately, if these symptoms persist for a long period of time, number of complications will start appearing. Like chronic liver disease, cirrhosis, and sometime it may change into a very dangerous condition, which is a hepatocellular, that means cells of the hepatic, they have become cancerous carcinoma. So coming down to the complications, fatigue will be there for a long period of time. Ascites mean the fluid has accumulated inside the peritoneal cavity. It is actually a type of edema. Edema in the peritoneal cavity is. Then bleeding. Now if the liver is not functioning, clotting factors are not produced. Clotting factors are actually the proteins. So liver is not functioning, proteins are not produced, clotting factors are not produced, person will suffer from the bleeding because of the decreased synthesis of clotting factors. Now there is a hepatic encephalopathy. Encephalo mean brain, pathy mean disease. Actually one of the important function of liver is to detoxify ammonia to form urea. Now if liver is not functioning, ammonia will persist in the body and ammonia will move into the brain, and this ammonia will damage the brain. That is called as encephalopathy. That means failure of liver to detoxify ammonia and entry of ammonia in the brain to produce the brain disease. Some other symptoms: hyperexcitability of the person, impaired mental activity, confusion, seizures, epilepsy and coma. These are the extreme symptoms that may happen in the chronic hepatitis. So now this is the difference between hepatitis A and hepatitis B. I told it is non-enveloped, it is enveloped. RNA is the genetic matter, DNA is the genetic matter, route of transmission is orophycal, here is sexual, perinatal, contaminated blood. Acute hepatitis is mild to severe. In hepatitis B, acute hepatitis is present but mostly severe in nature. Chronic hepatitis is rare, but chronic hepatitis is common. Complications are rare, complications are common. So now coming down to the another type of hepatitis, hepatitis D. So now again caused by hepatitis D virus. It is small enveloped RNA containing virus. So why I am discussing hepatitis D and B? Because of this line, hepatitis D can propagate only if there is already infection of hepatitis B, not alone. And route of transmission is similar to that of hepatitis B. So clinical course, now the person is suffering from hepatitis B, there is another infection hepatitis D, so obviously you can say the symptoms will be very much increased. So co-infection with hepatitis D virus increases the severity of hepatitis B, more chances of development of liver failure, and disease will rapidly progress to liver cirrhosis or liver cancer and increase in the mortality rate. So this is what I wanted to discuss with you about the hepatitis B and D. In the upcoming video, my focus will be on hepatitis C, its etiology, pathogenesis and the symptoms. Thank you.